Right. Hi, my name is Aileen Kucsera. I'm a clinical psychology doctoral student at the Stanford PGSP PsyD Consortium. And I'm going to be speaking with you today about my research, my dissertation research specifically, looking into mental health care clinicians' knowledge and attitudes towards psychedelics. So I want to start off by telling you a story about a patient. And this is not a real patient, it's a fictitious patient. And her name is Wanda. And Wanda is a 47-year-old woman, and she has been dealing with depression for over 20 years. She has taken multiple different antidepressant medications. She's seen a therapist. She's been involved in individual therapy, group therapy, and tried multiple different modalities to treat her depression, but continues to have symptoms. And she feels discouraged because of the lack of additional treatment options and has started to become pretty hopeless about her ability to ever feel better. And one day she's scrolling through her social media and she sees an article that a friend of hers has posted about psychedelics for depression. The headline kind of captures her attention and she clicks and she finds herself reading this New York Times article that's talking all about how psychedelics are being used to treat depression and how effective they are. And she finds herself really curious and she kind of goes down this rabbit hole and learns a lot about the various clinical trials going on for psychedelics for mental health reasons, and starts to become kind of curious if this is something that could help her. And so she sets an appointment with her therapist to talk about this. And she shares with her therapist what she's been learning, what she's been reading about, and says that she's really interested in trying this, and asks her therapist, "What do you think about me taking psychedelics for my depression?" And to her surprise, her therapist doesn't really have a clear answer. Her therapist tells her that she hasn't really been trained in this. She doesn't really have a lot of background information. She doesn't really know how to advise Wanda on how to use psychedelics and if she can and if it's safe. And she doesn't really have the ability to share. She says she'd like to be able to support her, but doesn't really feel comfortable providing any advice because she doesn't really know what to say. And Wanda kind of thinks to herself, gosh, with all this research out there, how does my therapist not know? And so that's the situation Wanda finds herself in. So I'd like to pause there and kind of just consider, like, where do Wanda and her therapist go from here? And so to kind of explore that together, let's just back up and we'll zoom out a little bit and figure out how they might be able to move forward together. So here's a brief summary outline of what we're going to be talking about today. So we're going to start with a little bit of background. So why are we talking about this topic and why is it important? I'm going to share with you a little bit about just the current landscape of psychedelics in the US, including media coverage, public interest, and legal status changes, and obviously the clinical research into psychedelics for therapeutic reasons. Then we're going to talk about my research into clinicians' knowledge and attitudes towards psychedelics, and I'll share the kind of key results and takeaways from my findings. And then talk about what the results of my research mean, so the clinical and public health impacts and potential. And then finally end with some guidelines or recommendations for the future. So as probably a lot of you know, if you're here watching this presentation, there has been just a huge increase in interest in psychedelics over the past several years. There's really widespread media coverage, and psychedelics are gaining pretty mainstream acceptance after being dismissed as maybe these dangerous drugs of the counterculture previously. And so there's a lot of positive media coverage. So well-respected media outlets like the New York Times have published many articles kind of with the headlines shown here. And also New York Times bestselling books such as How to Change Your Mind by Michael Pollan. And these really both reflect and are contributing to this increased public interest in the therapeutic application of psychedelics. And there's also been this shift in the legal status of psychedelics since 2019. So while psychedelic substances are considered illegal at the federal level and they're placed in the most restrictive category for drugs, there are some changes that have been happening at the state and local level since 2019. So psilocybin, the psychedelic substance in magic mushrooms, this has been decriminalized in 9 cities in the US and DC. And for those who aren't familiar with decriminalization just means that the personal possession and use of psilocybin would become the lowest priority for drug enforcement. but the federal and state laws would still kind of consider the substance illegal. And so, yeah, psychedelics have been decriminalized, like I said, in 9 US cities. And then in 2021, so just last year, there was legislation proposed in the state of California to decriminalize psychedelics statewide. And then in 2020, the state of Oregon voted to legalize psilocybin for therapeutic use. So there's these shifts happening at the state and local levels with regards to psychedelics. And then obviously the shift in public opinion and legal changes are happening alongside clinical trials that are looking at psychedelics for a range of psychological disorders. And while this research is still in its early stages in many ways, there is growing evidence that suggests that psychedelics are safe and effective for a range of mental health issues. And so psilocybin has been studied in clinical trials for the treatment of depression, for cancer related to end-of-life anxiety, and for substance use disorders, specifically alcohol use and tobacco use. And then MDMA has been studied in clinical trials for the treatment of post-traumatic stress disorder. And the results from these trials so far have really had quite promising and positive results. They've shown reductions in symptoms of depression, anxiety, alcohol use, smoking, and PTSD symptoms across these clinical trials. And in some instances, this reduction in symptoms lasts for up to 6 months following administration of the psychedelic with therapy. And while this initial data is really promising, there are some limitations to this research that are worth mentioning. These trials have been done with a really small number of participants, and of the participants in the trials have mostly been white. And so this really limits the ability of how much we can apply these findings to the general public. However, this emerging evidence is really suggesting that psychedelics are safe and effective at treating a variety of psychological problems. And results from these trials are certainly informing a lot of the positive media coverage and contributing to shifts in public opinion, which we'll talk about next. And so if we think back to Wanda, so Wanda's read about psychedelics and she's interested in taking them, but what does the general public think at large? Is Wanda representative of that? So a survey that was conducted in 2020, it was a survey of 1,000 American and British adults, found that 63% of the participants in the survey were interested in taking psychedelics for their own personal, therapeutic reasons. And that 51% supported the legalization of psychedelics for medical use. So in terms of taking psychedelics for the therapeutic use, it's kind of similar to Wanda's interest. And then this legalization is really similar to what Oregon has done, this idea of legalizing psychedelics for therapeutic use. So there's shifting public opinions. And then also, in addition to this, many individuals are pursuing psychedelic experiences outside of medical settings, and more specifically for mental health reasons. So in 2010, there were an estimated 32 million psychedelic users in the US. And then in between the years of 2015 and 2018, there was a documented 56% increase in recreational LSD use. And then interestingly, this is a more recent study that was published just last year related to the pandemic. And they identified that 46% of adults who had previously used psychedelics for any other sort of reason specifically took psychedelics to deal with issues related to the pandemic, things such as pandemic-related stress or pandemic-related boredom. And so why does this all matter? So given the results from the clinical trials that I shared, these trends in public opinions that are kind of shifting, and the evolving legal status of psychedelics, at least at the state level, it's really likely that mental health care clinicians will encounter patients who use psychedelics and maybe even be expected to advise them about use. However, we really don't know much about how clinicians use psychedelics, how much knowledge they have, how they perceive these, their attitudes, is there stigma. And providers and clinicians' knowledge and attitudes really can impact the advice that they give and their ability to support patients. It may impact their willingness to refer patients for these treatments, or just their ability to work with patients who are curious about accessing psychedelic treatments, and could result in a situation kind of like Wanda's. So what did I set out to do in my research? So I wanted to know kind of the things I've just mentioned. How knowledgeable are clinicians about psychedelics, specifically mental health care clinicians? I also wanted to know, what are clinicians' attitudes towards psychedelics? And then finally, I wanted to know, how comfortable are clinicians in advising patients on psychedelic use? So how did I do this? I surveyed psychiatrists, psychologists, social workers, and marriage and family therapists in California, where I'm located. And this is the group of providers that I'm referring to when I say clinicians or providers throughout my talk. What did I do? I created an online survey that had 37 questions related to the 3 topics I mentioned. So questions about knowledge about psychedelics, attitudes, and then comfort. And then how did I do this? I emailed this out through professional organizations in the state of California. So through organizations like the California Psychological Association, the California Association of Marriage and Family Therapists, just through the listservs of people who subscribe to those organizations. And so what were the findings? So coming back to Wanda, just thinking about her clinical situation, did she have bad luck in just approaching a certain therapist who didn't know a lot? Or is this kind of more reflective of clinicians in general, at least in California? So I had 237 providers who completed our survey. They were mostly psychologists, social workers, and marriage and family therapists, very few psychiatrists. And the clinicians who responded, they reported limited knowledge about the legal status and current research. So they were really unaware of the current applications of psychedelics in clinical research and the legal status. They also reported low self-ratings on knowledge about the risks and benefits of psychedelics. And then many didn't feel comfortable or knowledgeable enough to counsel patients on psychedelic use. This is 45% of the participants. And I have a graph figure on this next slide to show you. So the statement on the survey was asking participants to either disagree, strongly disagree, to strongly agree with the statement. I have adequate knowledge to talk with patients about psychedelics. And as you can see on the left here, the bars that are orange and green, adding them up, almost half, this is at 45%, disagreed with this statement. And this is actually similar to other research findings where the majority of psychologists indicated that they were only somewhat knowledgeable about the risks and benefits of psychedelic use. And when it comes to attitudes, how did providers in our survey perceive psychedelics? So overall, most of the providers expressed favorable views towards the legality of psychedelics and of the therapeutic use of psychedelics. So most agreed actually that psychedelics should be legalized for medical use, and agreed that psychedelics really can be useful in treating mental health conditions. They were really optimistic about the potential benefits. So a large amount, 78% of the respondents were optimistic about the potential benefits. And they did express some concerns about safety, especially in recreational settings, and about the possible psychiatric risks of use. And then lastly, coming to the clinician's comfort level and interest. So our survey results indicated that the majority of clinicians currently are discussing psychedelic use with patients, at least on some level. And they also endorsed that patients are coming to them asking for advice about psychedelics, so similar to Wanda. However, clinicians reported feeling uncomfortable addressing patients' questions about the effects of psychedelics. And I actually have a figure on the next chart, on the next slide, to dive a little bit more into that. But finally, in terms of interest level, most of the survey respondents were interested in learning more about psychedelics, so 73% of the providers surveyed. And this is just to show a little bit more about that comfort level question. So again, the statement was, I'm comfortable addressing patient questions about how psychedelics might affect them. And on that same scale, from strongly disagree to strongly agree. And as you can see here, if we look at the left, again, the orange and green bars, most actually disagreed with this statement. This is like 49% of the respondents. So kind of all together, these findings not only point to a lack of knowledge about psychedelics, but also that clinicians aren't really prepared to address these types of things with patients, despite being somewhat positive and having favorable views about the potential of these treatments. So what does this all mean? yeah, I think like the overall summary is, yeah, clinicians are interested in learning more. They have favorable attitudes towards the benefits of psychedelics, specifically for therapeutic purposes, yet they lack knowledge and feel unprepared to advise patients about use. So this is kind of similar to Wanda's situation with her therapist. And I guess talking about next is like, what does this all mean? So a lack of knowledge and comfort can really impact how providers respond to patients who inquire about psychedelics or who just wish to discuss use outside of clinical settings. And without adequate knowledge, providers could just be responding to patients based on their best guess, on assumptions they have or their own beliefs, on things they've read in the media, or just not really any information at all. And there could be really significant consequences of this. And I want to highlight a few. So the lack of knowledge about psychedelics could lead to harmful advice. This could lead to clinicians potentially providing harmful advice, failing to inform patients about the effects of use, what to expect. Conversely, sufficient knowledge could lead to the opposite, could lead to helpful advice, appropriate advice based on the data, based on the science about the risks and benefits of psychedelic use. And kind of coupled with this advice is this idea of safe use and unsafe use. So a lack of knowledge could potentially lead to unsafe use, where individuals are taking psychedelics without appropriate kind of counsel or recommendations, without proper preparation, maybe in unsafe settings. And the opposite of that, obviously, sufficient knowledge from a provider standpoint could lead to potentially safer use of patients of psychedelics, because they'd be appropriately counseled on the potential risks and benefits, on ways to safely prepare. And then another thing here I'd like to highlight is a lack of knowledge could really lead to a decreased likelihood of positive outcomes. So individuals may still choose to take psychedelics outside of clinical settings, but they may not get the same benefit that they would if they had properly prepared or had the proper advice, or the support after a psychedelic experience to process the experience. And then again, conversely, sufficient knowledge could lead to increased likelihood of positive outcomes, where providers with enough knowledge could support patients in processing a psychedelic experience, potentially minimizing any subsequent harm that could come from maybe a bad trip or a challenging experience, or just processing the experience to identify insights that could lead to healing. And then finally, another impact this could have, at least the lack of knowledge, is in terms of access to care. So lack of knowledge could lead to individuals maybe not taking psychedelics or not even accessing them because providers aren't able to provide any advice, and they are kind of cautious and just say, oh, I'm not going to approach that at all. I'm not going to be curious at all. Could also lead to decreased referrals, recommendations for these treatments, whether it's within a clinical trial or in places where psychedelics have been legalized, or if and when these treatments do become available. And then conversely, sufficient knowledge could obviously lead to increased referrals, increased access based on kind of adequate knowledge and sufficient knowledge to guide patients or individuals towards the appropriate treatments. So where do we go from here? What are some of the recommendations based on my research findings and kind of given the whole picture here? So it's clear that patients are approaching mental health care providers and clinicians are seeking information about psychedelics, and yet providers are really unprepared. They don't have the knowledge, they don't feel comfortable doing this. And so first, there's a really clear need to better educate both clinicians and probably the general public on psychedelic use. And specifically, one way to do this is through the development of formal guidelines to support psychedelic use. This could the intention behind this would be to minimize the risk of psychedelic use and really increase the likelihood of positive outcomes. And this could be like a formal set of recommendations to help clinicians appropriately discuss psychedelics use with patients based on the science, based on the emerging literature, and obviously kind of with thoughtful consideration of ethical and legal issues as well. And development of these formal guidelines would likely increase providers' comfort level having these conversations, but also in their competence, knowing kind of what to reference and how to appropriately guide patients surrounding psychedelic use, again, with this whole aim of reducing any harm, reducing any risk, and maximizing really the full therapeutic benefit. So what are the big takeaways here? Clinicians, I've said it already, but just so we have it clear, clinicians are really interested in learning more about psychedelics, at least in the state of California. They have favorable attitudes really towards the therapeutic use of psychedelics. However, they really lack the knowledge to advise patients. And so the kind of key push here, and the thing that the big takeaway that I see from this research findings, which really is corroborated by other research in the area, is that there's just a real need to increase psychedelic education, mainly directed at providers, but really to the general public as well, to really just, again, minimize the risk of use and maximize the potential benefit. So I wanted just to end here with just some resources. These are helpful resources about psychedelics and psychedelic use. Please check them out if you're interested. And thank you for your attention.